Oh, we can hang
Hello,
up
Mark.
on him.
Hi. Yeah, I can.
Hey,
Talk to me. What's your name?
6 years old,
We need your name.
Chris.
We need your name. We don't do anonymous calls here.
His name's Chris. He just told you 4
Chris.
times. Chris.
Well, he told me while I was talking over the top of it, which is one of the things that I most often get complaints about. Right. All right. So, Chris, you're 26 years old.
Yes, I've been doing your program for 2 months.
Mm-hmm.
Gone a lot stronger.
Yeah.
Thank you. But so I got my testosterone levels checked, and it was 427 nanograms per deciliter.
Mm-hmm.
I had some symptoms of kind of low testosterone,
Mm-hmm.
and I was wondering, would you recommend that people with lower testosterone train more like an older individual, or does it matter at all?
I don't think that it matters because you had one testosterone test, right? You only had it tested once. You have to remember that any kind of blood chemistry test like that is a snapshot. All right? It's the same thing as me following you around with a camera and taking 5 pictures of you during the day. That may or may not be a representative sample. The pictures I take may not be a representative sample of your day. Now, that having been said, testosterone levels in the blood are fairly stable in terms of the day. You know, you don't vary 200 nanograms per deciliter across the length of the day. It doesn't work like that. If you're at low fours and you're 26, I think that what I would do is just continue to train like I've been training, and in another month, get it checked again, and in another month, get it checked again. And if you don't like the trend, or if the thing is stable in the low fours, get somebody to prescribe some TRT, because that is kind of low for a guy your age. All right, but by the same token, and we talk about this over and over, by the same token, the reference range in a testosterone test is not necessarily indicative of what your response to that range is going to be. There are some people who are at your level in the low fours that are absolutely showing symptoms of hypogonadism. You know, they need more tests. And there are other people who operate just fine at 300. You know, so in other words, it varies. If you've got symptoms, then you treat the symptoms with more testosterone. And if you don't have symptoms, you don't worry about it. And because the reference range is not what doctors think it is, all right? Doctors are unfortunately in our system are more trained than they are educated, and they're taught that this number means the following thing, and this number means the following thing, when it doesn't necessarily always mean the following thing. And but they're trying to see 3 patients every 30 minutes, or in some cases 14 patients every 30 minutes. And they're not, you know, they're just going through there with a checklist, and you know, wherever you happen to fall on the spectrum on the checklist is what they do, right? And that's not good.
I've gained, I've put on about 150 pounds on my squat and deadlift, and they're into the mid threes and close to fours. So I was thinking maybe it doesn't really matter.
It probably doesn't. A kid your age is not typically who we look to need testosterone supplementation. You know, when you get to be 40, we'll have a different conversation about this. But if you're 26, you ought to be just fine. I mean, just fine, right? You ought to be training your ass off, eating 5,000 calories a day, getting strong, getting big, and plowing a swath through all of the females that you come in contact with.
All right.
I'm trying my best, Mark.
I assume you are. And good luck on that. Okay.
Lying a swath.
Yeah, I'm pretty busy on that last.
Good for you. Good for you. It's an important time in your life, and it might not last forever. So enjoy it while it does. Thanks for your call.